Let's take a moment to discuss exercise intensity. Hopefully by this time, you've watched my introductory video on my YouTube channel where I discuss exercise intensity in achieving your goals of 150 minutes of moderate intensity exercise per week. So at the end of one of my 10-minute routines, you should have a perceived exertion rate of a number 1 through 4 out of a scale from 0 to 10. So what that means is that at the end of one of my 10-minute routines, you should have a quickened heart rate or feel your heart pounding just a little bit. Your breathing will be quicker and shallower. You're probably warm or have broken a little bit of a sweat, but you can absolutely continue to carry on a conversation. You can continue to walk from point A to point B. And when you do sit down to rest, you can recover rather quickly. So that's a rate of perceived exertion from a number 1 to 4. When you get to 5, 6, or higher, you've now achieved a moderate to vigorous workout or just a vigorous intensity workout. So one question that I've been receiving is, well, how does that relate to my heart rate? And I wanted to give a quick description on how you can measure your own heart rate, but there's a very big disclaimer that has to be discussed. For many patients who have undergone cancer treatment, if you have gone through chemotherapy treatment, there is a very large chance that you have some cardiac side effects. It's going to be exceptionally important for you to discuss with your own medical team how that is going to affect you and your new exercise regimen moving forward. You may not have numbers at all similar to what I'm going to discuss. Your doctor may want you to keep your intensity lower. That's why perceived exertion, or how you feel, is going to be much more important than numbers that you actually see. And that's for certain patient population. So please, if you've undergone chemotherapy treatment or if you have known cardiac side effects from your cancer regimen, please, please, please make sure you speak with your medical team directly and get specific instructions on what you're looking for in order to achieve moderate intensity exercise. Okay, so now that I've gotten that out of the way, I want to show you the tool that I use in my clinic. This is called a pulse oximeter. Mine is battery operated, so I have a button that turns it on. It just clips open and you put it on your finger. It's going to take a few seconds for it to read, but it gives me 2 readings. Okay, it's still reading. So my top reading is my oxygen saturation, and my bottom reading is my pulse rate or my heart rate. For oxygen saturation, you're looking for a number at 100 or as close to 100 as you can get. So I'm at 99. 98, 99, and 100 are the optimal measurements for when you're sitting and when you're resting. That number will typically go down just a little bit when you're exercising. But for my purposes, I don't ever want to see you have a number lower than 95. Again, your physician might tell you differently, but absolutely anything under 90 is going to be dangerous and requires the attention of your medical team right away. So please make sure if you are looking at oxygen saturation, you know what your numbers and goals should be and when you should be reporting to your physicians. The lower number is my heart rate. So sitting here and resting, I've done a few takes of this and I've also had a lot of coffee. So my resting heart rate right now is at an 86. Okay, so obviously I know that as I start exercising and moving my body, that number is going to raise a little bit. What would my goal be for a moderate intensity exercise program? Well, the first thing you need to know is your absolute max heart rate that you should ever get to. To find your max heart rate, you're going to take the number 220 and subtract your age. So I'm going to take 220 and subtract 40. My max heart rate is then 180 beats per minute. So I never want to get above 180, even when I'm having the most taxing workout imaginable. So to find moderate heart rate, the American College of Sports Medicine asks that you achieve a 65% measure of your maximum heart rate. That diagram is also attached below. So when I look at 65% of 180, that gets me to 117 beats per minute. So that should be my goal for a moderate intensity exercise workout. I want my heart rate to get to 117 beats per minute. However, if you are just starting out an exercise routine, a moderate intensity workout can actually start anywhere from 50% of your maximal heart rate and go all the way up to 70%. So we still want to try and achieve the ACSM's 65% goal. But if you're new to exercising and working out, I think it's safer to start at a 50% of your max heart rate. So in my case, 50% of 180 beats per minute would be 90 beats per minute. So for a moderate intensity exercise routine, at the end of my 10-minute program, if my pulse oximeter shows a measure of 90 beats per minute, that means I'm doing pretty good. I have a moderate, or in my case, probably a low to moderate intensity workout. Again, how that rates to my perceived exertion is going to be a little bit more important, in my opinion, what you're trying to achieve at the end of 10 minutes, and then optimally at the end of a 30-minute workout when you get to that point. So sometimes people like to take measures before they get started, at the end of their exercise routine. Sometimes they try and wear this the whole routine. I will tell you that the numbers get a little bit skewed if you start sweating or if it falls out of position on your finger. So again, maintaining a heart rate of about 65% is our goal. Throughout the course of your routine, you still want to have your oxygen saturation at 100 or as close to 100 as you can. And then you might want to see how long it takes for your heart rate to recover from wherever you were at the end of your routine to 2 minutes later, 5 minutes later, etc. How long does it take you to get back to your resting heart rate? So I hope this has been helpful in determining heart rate as well as perceived exertion and what the difference is when you're trying to achieve a moderate intensity workout program. Please find whatever works best for you and clear it with your medical team. Let's get ready to work out.